Mukhang lagi kang stressed kasi. So, perfect na perfect tong topic sa'yo. Diba, Jace?
Oo. Perfect to para sa mga nagtatrabaho tapos nag-aaral din. No,
Yes,
na
exactly.
katulad ko. So,
Dahil pag-uusapan natin ngayon ay pain management, na pain galing sa stress. At ngayon kasama natin
si Dr. Chris Mancao, isang muscle pain specialist. Magandang umaga,
Good
Doctor.
morning.
Magandang umaga din sa inyo.
So, sir, ano po ba yung usual causes ng stress?
Well, stress is your reaction to your environment, hindi ba? How you react. Something that might be pleasant is stressful for other people. Eh, dalawang klaseng tao sa mundo. May sadista at masokista. The sadista, they cannot tolerate pain. That's why they keep on giving pain to other people. But the masochist enjoys the pain. So, which one are you? That is the better question. So, those who are not complaining, they might be masochists.
Actually, alam mo, Carla, totoo yung sinabi mo, no? Talaga excited din ako sa malalaman natin ngayong umaga dahil this is really useful for students, no, mga office workers din, di ba? At mga taong generally, di ba, kailangan talagang ma-stress araw-araw dahil sa trabaho nila. Pero doctor, ano ba usually yung mga masasakit na muscles sa isang taong sabihin natin siguro nasa opisina nagtatrabaho?
Which is more common.
Yes, doctor.
Because sa posture, you have neck pain and headaches. Yan ang pinaka-common. But because may bagong gadget na yun, pangalan ay laptop, 87% of young people have low back pain. And 13% do not have laptops. Isn't it funny?
So, sakto talaga.
Yung posture, it's posture-induced.
Yes, that's true. Ako dati, I used to work in an office. So, parang na-encounter ko na rin na whole day parang nakaganon lang ako.
At
So,
masakit
I guess-
yung lower back mo,
Yes,
Carla.
and yung neck.
At
So,
yung neck.
yes.
Paano nga ba, Doctor, na tatanggal itong stress sa head at sa neck?
You have to look at the personality ng mga pasyente. Kung type A ka, obsessive, compulsive, very regimented, you have a problem because yung bagay na hindi problema, ginagawa mong problema, so it becomes a stress. Becomes a stress for you. But the others, type B, one tamad, hindi guwaba to fall down. Wala stress yun. So you see, those who are always complaining, neck pain, shoulder pain, back pain, it's either work-generated or work-oriented stress, and of course, the way they sleep. But the more common for females, yung mga bag. Kasi even if you put a small bag here, nakataas yung shoulder. Kung nakataas yung shoulder, di yung spine niya nakatagilid na ng ganito. So they are functional scoliotic.
Okay. So, Doc, you mentioned posture. Can you give us a few tips kung ano ba talaga yung tamang posture?
Kasi ang normal posture when you're erect, your shoulder should be like this. But because of the day-to-day job, you have to do like this. The weight of the head is 14 pounds. So the poor neck muscles have to counterbalance the weight of the head. And as you grow older, your posture becomes more leaned forward. That's why you have more severe arthritis and back pain.
Right.
How can you do that? So when you're still young, you better try to develop a better posture so that as you age, it will not be as bad.
Even as you use your laptop, Doctor.
If you're using your laptop, you better put it on a table, the best. And ergonomic ang design. Ibig sabihin that your posture is maintained. Nakaganito. You have a good back support. Yung, your relationship with the chair and the table, yung height, has to be comfortable. Most of the U.S., what you call these tables and chairs, a lot of Filipinos will not fit there. It's either too high, and then the others might be too low. Ang sa atin naman is, don't look at your comfort zone. Kasi if you're looking too much on your comfort zone, you might be slouching too much already. Kasi other people are looking at TV propped on 2 or 3 pillows. They're complaining always of back pain. Hindi naman tama yun.
Okay. So, Doc, what are some ways nga to manage the pain? What are the methods?
Number one is do extension stretches. Yung mga extension, yung mga ganyan. Why? Because everything is more flexion. In the gyms, most of them are all flexion exercises. We need more extension exercises. And the better thing is, don't think of things that you don't have to think right now. You become more stressed.
Right.
Just solve one problem at a time.
So, like worrying about the future.
That is it.
Or yung future na hindi mo pa dapat talagang
Yes.
iniisip pa. No?
Yeah.
Oh, actually, maganda rin yung na-point out ni Doctor dahil as far as I know, it really has a lot to do with ergonomics. Kung paano ba yung office setting mo, kung paano ba yung study area mo. Doctor, I've always wondered about this. Ano ba dapat distance siguro from your laptop, tapos ano ba dapat yung angle ng iyong pagtingin sa iyong laptop? You mentioned kasi minsan too high or too low.
One of the factors is the illumination of your screen. That is very important. Whether it's high or low, the problem is if the illumination is too, what they call this, dim,
Right.
The tendency is you're going to put your face closer to the screen, and that will be bad for you. So you adjust the illumination of your screen so you don't have to lean forward. The best is actually a more neutral position. Neutral, meaning to say, dito lang, nakaganyan ka lang, like this. But most of us don't do that. We're crouched forward like this. So after 1 hour, 2 hours, you complain of pain.
I guess this is a big problem nga that we have to address. Kasi naiisip lang natin, oh, we're working, yun yung cause ng stress. Hindi na natin naiisip na it's the
Posture.
way we use our laptops. And ngayon nga, lahat ng tao naka-laptop. So baka naman in the future, lahat ng tao nakakuba na. So talagang kailangan bigyan pansin kung ano ba dapat yung tamang posture.
You will see that in the internet, the progression of man from the monkey becoming Homo erectus. Now they are back to become a monkey again because doing like this. You understand yung posture na yun. And although it's good for my business, the more the pain, the better. The better one is prevention.
Right.
So better posture. And females, my only advice is yung mga bagay na hindi na kailangan every day that you have to bring in your bag, like receipts 20 years ago, please don't bring it.
So kahit papel lang, no,
Yeah.
ay nakakadagdag doon sa
So always
sa stress.
clean out your bags para sa mga babae dyan. So Doc, yung way of yung pain management ninyo, it's all about release. There are no medicines involved.
We don't use medicines in pain relief. My brand of pain relief, because medicines are also harmful. And the unmonitored use of these drugs are very, very harmful. So you mentioned any medicine for pain. By the way, when you are in pain, you are acidic. So yung mukha nyo dato puti. All the medicines are acids. All. Can you imagine? All the non-steroidal anti-inflammatories, they're all acids. So what happens to you? You become more acidic. Sumasakit yung tiyan nyo, kumukulo. And then what are the net effects? It will destroy your kidney, destroys cartilage, and destroys your stomach. So other specialists will be seeing you. For your headache, because of your continuous take of medicine, you have your gastroenterologist to check your stomach, your kidney specialist, and of course, the rheumatologist.
So basically, doctor, hindi dapat masyadong puro painkillers.
No.
Kapag you're experiencing headaches or neck pain.
In our clinic, we easily remove migraine headaches by 1 second only. It's only 1 second to abort it, and a 15-second manipulation will make you headache-free for 2 to 10 years. But the migraineurs, they will miss their pain. They will miss their pain. Nasanay na sila sa pain nila eh.
Ano yung method ninyo, doctor, if you don't mind us asking?
We do very brief manipulation. We just touch the patient in
Right.
15 seconds. Low back pain is a no-brainer for us. Kasi yung mga operable low back pain, in 60 seconds, they stand and jump and bend and reach the floor. But these are patients who cannot even move. A lot of females, they are rotoscoliotic because of heavy bags. And these are very easy to treat. It's only 15 seconds.
But then if we let the pain last, hindi tayo gagawa ng management efforts, ano yung mangyayari?
Remember, you become dysfunctional. Your relationships with other people will be affected when you're in pain. A very simple decision becomes a difficult decision because you're in pain.
Right.
Yes.
Actually, Carla, medyo meron akong sariling interest din dito. No? Tatanong ko rin si Doctor. Doctor, kapag kunyari masakit yung dito manda, parang back nung shoulder, ano
I
usually
have
yung...
that too. So,
Ako rin eh.
yeah.
Ano usually yung cause noon?
Of course, the more common sa females is
With the bags.
heavy loading. The other one is posture, definitely, and can be previous injuries or injuries or accidents before, and change in weather. Because if you have micro injuries or old scars during cold weather, it will contract more than the normal tissue, so you're going to have pain.
And
Okay, so pati pala weather, no?
Yeah.
Pati
Yeah,
panahon,
it can trigger pain.
And Doc, you mentioned kanina parang shoulder strap that you can use to pull back your posture. Right?
Yeah, because the head has to be in a neutral position.
Yes.
So if you're wearing an appliance which we call a shoulder strap, it's just a strap that makes your shoulder go like this. Then your tendency is you cannot put your head like this because your shoulder is like in the back already. Your tendency now is to bring your head backward.
Okay.
So what would you suggest, Doctor, sa mga talagang kailangan magdala ng mabibigat na bag siguro? For example, mga estudyante natin, nagdadala ng mga libro. Paano iba yung tamang pagbuhat ng mga mabibigat na gamit?
The school should do something about that. They should not let the children bring all these heavy bags. Because like us in medical school, yung libro namin ganyan kakapal. And if you have to bring that, they always joke, are you going to the gym? Naintindihan niyo? But who are carrying bags, very big bags ngayon, kasi the bags are becoming bigger and bigger.
Right.
And that is giving them a problem. So you have to walk with good swing, shoulder swing, balance. How can you do that when you're like this? Kasi takot ka na may snatcher sa likod na bubunutin yung bag mo. The best is a belt bag. Now she's going to say, that's not fashionable, di ba? Dikitan mo kaya ng Swarovski diamond sa harap. It becomes very
Lalagyan ko
fashionable.
ng fur. Fake
Pero
fur.
hindi ba mukhang mga malengke ka, no? Doctor. Pero ako nga ni Doctor, is a backpack better than a shoulder bag?
Most of the backpacks are used the wrong way.
Alright.
A lot of backpacks are only shoulder packs.
Exactly.
And most of them are very loose. You understand? It's very loose. It's hanging way out the back.
Alright.
So it should be properly adjusted so you can maintain this kind of a posture.
So dapat pala medyo masikip. Yung
Properly adjusted.
Yes, and these tips have been very useful for us, and I'm sure marami ring naka-benefit dito. So, Doc, meron ba kayong final message? And kung gusto rin nila pumunta sa'yo for stress management, saan po kayo mahahanap?
Well, we're just at Ortiga Center for Pain Management. They can call us up at 494-4940. It's very easy to remember, 494-4940. The most important thing is medicines as much as possible because it will give you problems if you keep on taking it. Now, pain management is outright and simple. You can remove pain in just seconds.
Right.
Even severe osteoarthritis, the arthritis, can easily be removed now in so short a time.
Doctor, the name of your clinic is?
Mancao, Dr. Mancao Pain Management Center.
Alright, so mukhang dadalaw tayo doon, Carla.
Malapit lang siya sa bahay ko, so saktong-sakto.
Exactly. Maraming salamat. Yan po si Dr. Chris Mancao, isang muscle pain specialist. So para sa mga office workers natin, mga estudyante na nakakaramdam na ng stress at pain sa kanilang katawan, maaari ninyong konsultahin si Dr. Chris Mancao.